Let's talk shoulder pain and dysfunction. My name is Carrera Williams. I'm a nurse practitioner at PC Medical Centers in Cape Girardeau, Missouri, and today I want to talk to you about shoulder pain and dysfunction and why early intervention is important. So if you have pain or weakness or decreased range of motion in your shoulder, it means that you have dysfunction. And if we can treat the underlying dysfunction, we can help treat those symptoms. Now, the shoulder is a complex joint, which means that those symptoms could be coming from a multitude of different issues. Things like rotator cuff strain or tear, adhesive capsulitis, which is also known as frozen shoulder, or a shoulder impingement. And all of these tend to present very similarly. So typically it starts with a pain, it may be a deep ache in the shoulder, and it may be worse at night while you're sleeping. Eventually this may turn into weakness. It may turn into decreased range of motion. So a lot of patients with shoulder dysfunction are having a hard time getting their arms up, especially above that line of the shoulder. And what this means for them is that they're struggling to get through their daily life. So a lot of our patients have given up fishing or gardening, or they're not taking care of their grandkids anymore because they can't lift them up. I even had a patient come in and tell me that she couldn't wash her hair anymore, that she'd been washing her hair with her head bent to the side for months, hoping that her shoulder would get better. And while some diagnoses will improve over time, most of them don't. Most of these issues are going to continue to get worse, and eventually you may have irreversible damage. And that's why we don't recommend a wait and watch approach. We really recommend early intervention so that we can perform a full exam on you, identify the underlying root cause of your dysfunction, and treat that using a multidisciplinary approach. So that means that we can do some injections that might speed up your healing. We can use chiropractic care to help make sure that that joint is mobile and functioning appropriately. And we can use rehab to help treat muscle imbalances. And all of that put together means that you get improved function in the joint, but what it really means for you is that you have less symptoms, better range of motion, and better strength, meaning that you can get back to doing the things that you love, like gardening or fishing or taking care of your grandchildren. So if you have shoulder pain or dysfunction that's keeping you from doing the things that you need to do, give us a call, make your appointment for a free consultation, and come on in so that you can see how we can help you.